Hello, I am Julia Simoes Correa Galendi from the Institute of Health Economics and Clinical Epidemiology from the University of Cologne, and I am happy to present at the International Symposium on Focused Ultrasound our research entitled Early Economic Modeling of MR-HIFU compared to Radiotherapy for Pain Palliation of Bone Metastases. I declare I have no conflict of interest and inform that this research was funded by the Horizon 2020 program. Bone metastasis is a common condition affecting patients with advanced cancer, and despite the use of opioids, these patients still have uncontrolled bone pain. Radiotherapy is established treatment alternative, however, 30 or 40% have no response to radiotherapy, and retreatment is limited by the toxicity of cumulative doses. MR-HIFU, magnetic resonance guided high-intensity focused ultrasound, provides a similar overall treatment response, but much faster pain relief in comparison to radiotherapy. To anticipate the economic consequences of adopting this new technology, we conducted an early economic modeling study from the perspective of the German statutory health insurance to answer the following research question. Is MRI cost-effective when compared to radiotherapy for patients with bone metastases? For the main comparison, we considered two strategies. The comparator consisted of the current standard of care with radiotherapy, considering the current practices in Germany, which included single and multi-fraction radiotherapy. In the intervention arm, MRI could be offered as first-line treatment or a second-line treatment after a failed course of radiotherapy. The patient population consisted of patients with non-vertebral bone metastases originating from breast, lung, or prostate cancer who had a pain rated at least 4 in the American rating scale. A patient-level simulation model was then designed to incorporate all the events that were relevant for the comparison. The model had 1-month cycle length and lifetime horizon. We conducted several literature searches to identify input data for the model, and in the next slides I will guide you through it. After treatment with either radiotherapy or MR-HIFU, patients could have complete pain relief, partial pain relief, or persistent pain. We consider that a response after radiotherapy would happen after 4 weeks, while a response after MR-HIFU would take place in the first week following treatment. For both radiotherapy and MR-HIFU, there was a 30% yearly probability of a pain relapse. In that case, patients would move to the persistent pain state. Patients with partial pain relief or persistent pain could be retreated. They might die before having pain relapse or spend some time in the persistent pain state before being recommended a retreatment. The retreatment rate was 8% yearly for multifraction radiotherapy and 20% yearly for single-fraction radiotherapy and MR-HIFU. Pathological fracture could happen any time during the lifetime of these patients, and in the event of a fracture, we took into account the costs associated with fracture treatment and a decrease in quality of life that was also related to a fracture. We then calculated the overall costs and the overall benefits of both strategies to calculate the incremental cost-effectiveness ratio, the ICERs. To test the robustness of results, we varied all parameters within a given distribution in probabilistic sensitivity analysis. For a decision maker that has to decide whether or not to adopt MR-HIFU, the probabilistic sensitivity analysis answered the following question. What is the probability of MR-HIFU being cost-effective? Because the MR-HIFU is in the early phase of implementation, we hypothesized that the model results would be uncertain. Hence, we also set out to investigate what is the value of conducting additional research to inform decision-making. The value of information analysis considers the probability of MR-HIFU being cost-effective, the costs, the monetized foregone benefits, and the size of the population affected by the decision. We can quantify in monetary terms the expected value of having perfect information on model parameters, and then answer two main questions to the decision maker. Is it worthy to collect more evidence to inform decision making? What evidence should we collect? Based on our results, MR-HIFU costs more but generates more benefits in terms of quality and in terms of months with pain response. In details, The MR-HIFU strategy costed €399 more than the radiotherapy strategy, but resulted in 0.2 more QALYs and almost one full more month with palliated pain. The resulting ICERs were €19,845 per additional QALY, and in terms of month with pain response, €421 more for each month for each gained month with pain response. These results were stable across all cancer subgroups: breast, prostate, and lung cancer. MR-HIFU was slightly more cost-effective for patients with lung cancer. This can be justified by the fact that 90% of patients with lung cancer died in the first year, but although they still profited from the short-term benefit from MR-HIFU, they did not have the long-term additional costs with retreatment and fracture. So patients with lung cancer in our model had a slightly better cost-effectiveness ratio. Considering a willingness to pay of €2,000 per QALY, the probability of MR-HIFU being cost-effective is 52%. And at a threshold of €40,000 per QALY, the probability increases to 64%. So should we collect more evidence? Absolutely yes. Considering probability of MR-HIFU being cost-effective and the benefits foregone by not adopting MR-HIFU, the value of collecting additional evidence would be 178 million. This value means how much additional evidence would be worth for Germany to optimize patient outcomes. Based on the model results, we can also inform research prioritization. The parameters that would impact the decision the most are cost of MR-HIFU and fracture rates. In contrast, additional evidence about costs with opioid medication is unlikely to change the results of the model. Based on our results, we can conclude that in comparison with radiotherapy, MR-HIFU resulted in higher costs and more benefits, both in QALYs and months of pain response, for patients with bone metastases. The cost-effectiveness ratio was similar to various medical interventions for bone metastases. The model results still show considerable uncertainty regarding the cost-effectiveness of MR-HIFU, but with value of information analysis, we show that further studies would be worthwhile for reducing uncertainty, because MR-HIFU is potentially cost-effective for the German statutory health insurance. Lastly, evidence is needed, especially regarding costs of MR-HIFU and fracture rates following MR-HIFU treatments. The full publication and the sources cited in this presentation can be accessed by scanning the QR code. Thank you so much for your attention.